So Scotty came in this morning for his big surgery. We desexed him and he's about to go home now. So what we've got to do is just discuss his aftercare with regards to his sutures. He's had a big operation, but with the anaesthetic that we use these days, his recovery is very quick. So tonight he's allowed to have a bit of food and water. We'll only give him a small amount and just see how he goes, whether he's swallowing okay. If he is, then he can have the rest of his food. It's not uncommon for them to have a bit of a gag, a bit of a cough after they've had their surgery because they've had a tube down their throat. So don't be too alarmed about that. If he is not wanting the food, we're not too concerned about that. He'll eat for us in the morning. He's had plenty of medication while he's been in hospital, and he's had some pain relief as well. So from tomorrow, you'll see that he'll be running around back basically almost normal straight away. Tonight he might be still a bit sleepy from the anaesthetic that he's had. Those sutures he's got down there, we have to make sure that that looks nice and clean the whole time. Okay, we don't want to see any swelling around the suture area, no inflammation or discharge. While he's recovering for the next 10 to 14 days, we don't want to see him going swimming at all. He might have an occasional lick at the sutures, but if they're not getting inflamed or irritated, won't worry too much about that. If they are starting to get that way, that they get sore or inflamed, we can put an Elizabethan collar onto his head. So just pop back into the surgery and ask the nurses. I'll be able to fix you up with one of those. If you've got any concerns about his wound at all though, don't hesitate to give us a ring or just pop into the clinic. We're happy to have a look and make sure that everything is still going fine with the surgery. Those sutures are not dissolvable, so we do need to actually remove those. That'll need to be done in about 10 days' time from now. So again, the nurses will organise an appointment time. If I'm not available, the nurses can take those stitches out as long as everything looks fine. So it's about home time for you, matey. So we'll see you next time.